All right. Okay. You can start.
What do you want me to draw?
Oh, I'll tell you in a little bit.
Okay.
You get to start first.
Okay. Hi, my name is Veronica Rodriguez. I'm a student in phlebotomy, and I'm going to take your blood.
Okay.
Is that okay?
Yes.
Don't give them your last name either.
Okay.
No patient ever needs your last name.
Is there any particular reason for that?
Different. What's that?
Is there a reason behind that?
Your privacy.
Okay.
Because
you easily stalk you on social media.
Yeah, and I mean we have patients of all sorts that come in, and you can't take the risk. Right. So a lot of places will either just put your first name or your first name and last initial, just for your protection.
We'll start over again.
Okay.
My name is Veronica. I'm a student on phlebotomy. I'm gonna try your blood. Is that okay with you?
Yes.
Are you fasting? Have you had anything to eat or drink?
Yes. No. So
don't lie.
I have been fasting. Yes.
You have been fasting.
Yes.
Okay. Are you chewing gum or have anything in your mouth?
Nope.
Good job.
Your name and date of birth?
Antoine, August 2nd, 19.
Estoy viendo esto va.
Okay, good.
Make up a birthday when you give them, right? You made your birthday up, right?
Okay, yes.
Yeah, because it's not real. Let me know.
Do you have good arms, or do you have one on the other side too, or is that
just that one?
Just that one.
Just that one.
When he was in the bathroom.
Yeah, he's got just the good basilic one.
It's been through a lot because you can see the scar.
Yeah, that's from you.
No, not from me.
All right, hold on. So you found your vein.
Yes.
Now what do you do?
Take out the tourniquet.
Yeah, take the tourniquet off. Now, when you get better at it, we won't be doing that too. Okay. But you have to then prep the patient, and you are going to draw. Let's see. He hasn't, you know what? Quarantine hasn't been good to Antoine. He might have been binge eating and stuff. So we're going to do hemoglobin A1C and a glucose. You like that backstory? That was me. Right there.
A hemoglobin
A1C.
Okay. No.
Okay. All right. So, hemoglobin A1C. What is it?
Hemoglobin is cells. You tested the red blood cells.
It's in the cells, okay. Yes. So, out of all the departments, which department would test something in the cells?
Would be hematology.
Correct. So, what tube do you draw for hematology?
Purple.
Okay, so now rewind. This happens to be one of those exceptions to the rule. Hemoglobin is inside the cell, but we run the glycosylated hemoglobins in chemistry. So this is one of those funky exceptions to the rule. A hemoglobin A1C is also called a glycosylated hemoglobin. This is going to rise when your body's been exposed to glucose over time. So as glucose, you have more glucose, the hemoglobin becomes glycosylated. So it's a real good indicator of long-term glucose status over 3 months or so. So that's what we're gonna do. So you think glucose, diabetes, chemistry.
Okay.
Okay, so then what tube do you draw for glucose?
I'm assuming it's neither of these.
I didn't answer you on any of those. So where does glucose get tested?
Glucose gets tested in chemistry.
And what's your go-to tube for chemistry?
Yellow.
Gold. Stop calling it yellow.
Gold.
It's not yellow. Yellow is a very different tube color. That's gold.
Okay.
All right.
Maybe we should, is there a yellow one so I can see the difference?
I
Is it like
don't
really
know if
bright
I
yellow,
have,
or-
it's like
Yeah,
really
very
light
bright
yellow.
yeah.
I don't know if we have any here. It is like light yellow.
Okay.
Like, you can't miss it.
We rarely use them.
Cheryl, if you find one, bring one in. But we can't meet next week, which is annoying. Oh, and we all have to get COVID tested to go back too.
Oh, really?
Yeah.
I've never had one done.
Really?
Yeah.
Wow, lucky you.
I've never
It's not that bad.
I've lost count now.
I've had one.
Only one? Lucky.
One.
Lucky. All right. So now did you clean the site already?
Not
All
yet.
right, so that's what you're gonna do
Correct.
first, because you want to assemble your equipment while the site is drying. And remember, when we clean the site, remember you're actually trying to clean the wrong spot.
Yeah.
You got that? Okay. But when you're cleaning, you want to use nice firm concentric circles,
Yep.
and then let it dry. Do not wipe it dry. Do not blow it dry, because you don't want to lick his arm.
Right.
So is it just 1 week or 2 weeks?
So they're basically doing it to give an 11-day span between Thanksgiving and the first day we set boots on the ground. So that's good. He's clean now.
I forgot if I put the tube first.
No, ma'am.
Okay.
Never. Wait, hold it. You gotta do something first.
The tourniquet.
Uh-huh.
Okay.
Gotta put it back on.
Oh, gosh.
You're fine. Relax. You've already done this. What are you worried about?
I know, but
Put the tourniquet up just a little higher to keep it out of your way.
Okay.
Because I find that when it gets in the way, it makes it a little more difficult to draw.
I can't palpate because I already cleaned that.
Correct. So remember, you want to anchor this one really well. The pink in this case is the safety device facing up. Okay, so when you do that, you want to hold the tube right. Yeah, you want to hold that tube holder right. You want to check your bevel. Make sure there's nothing on the bevel. Okay, so now you want to anchor.
You'll see
No.
it right away.
Well, I do see I see like a little mark there and something down there.
Yeah, the stuff on that needle.
Okay.
No, never recap.
Okay.
Solid surface, undo his tourniquet and grab a new needle. Never recap. Let's go ahead and throw that away, try a new needle. That's why we always look.
If there's one, there's a good chance there's more. It seems to be lot related.
It will, especially here.
So now
Alright.
in this case where I had to go, should I tourniquet again?
No, because
Okay.
you have to assemble your equipment first
Okay.
before you put the tourniquet on. And then put the needle in, put your tourniquet back on.
I think what she's asking is, does she have to re-wipe the area again?
If it goes for an extended period of time, but just this brief time, I don't think you need to re-clean. But like say minutes go by, you got to do that again.
So are we zooming next week or is it possible?
I haven't decided what we're going to do yet.
Okay, this one.
Hello. All right, hold out on that out there. Does this one still look the same?
Yeah, no, it does have something there, you see it?
No, that one I think is good. Oh, no, it's not. For crying out loud. Just sit
Good
tight.
looking out.
We might have to switch boxes. Yeah. All right. Switch box. Yeah.
Just check.
All right. All right.
Is that for me?
Yeah, this is for you. All right, so go turn this on. Alexandra, Cheryl, once she's done dumping those, she's gonna come help you, because you haven't stuck yet.
Yeah,
So you're, if you can walk, or do you want me to walk her through the steps and you do this? It's up to you.
doesn't matter.
I don't really care.
So what does she need to do? with
She's got,
training
yeah,
arm,
she's
or-
got to walk her through the steps of the training arm, because she's only done the training arm a couple weeks ago.
All right.
Okay.
How are you? Good, how are you? Yeah, I think that.
That was good.
Okay.
All right.
Looking good. See, she's got your back. Okay, so make sure you hold it the right way. So what you can do is ask him to kind of hold his fist, but keep your arm straight for us. But just have him move the arm a little bit so you got a little room. It's tough with the wall right there. So remember, you want to anchor with your thumb, pull down, and then go right in, kind of like your Staying Alive song. Not too far. You just want to go right under. Okay, now stop. Yep, good. Use your fingers to anchor.
Two.
Yeah,
Okay.
Watch your tube angle there. Pull and push. You do it like this. Okay, so now release your tourniquet. Keep an eye on the needle as you do that. Okay, you don't have to do that anymore. Okay, let go of his arm. Okay, so take the tube. Remember, pull and push. Rock it. Good. Okay, go ahead and put it down. And then pull and push again. Use the phalanges like this, not like you were doing. Okay. Pull and push. Yeah. Good. Now just take it out. I don't want to fill everything because we're going to be doing lots of draws. Rock it. Nope, don't take the needle out yet. Okay. Now take the gauze. Don't push down till the needle is out. And then engage your safety to serve on a solid surface. Okay, and close your nace safety. Good. Okay, good. So one thing that's going to help you out is your angle was a little shallow. I obviously wasn't going to correct you while you were there, which is good because his is on the surface, and because of where it's located, you don't want to be near the artery or the nerve that goes through there, but you want to hold, like, so try next time, hold your fingers like this, because that's going to give you a little more leverage to be able to keep that angle. And then don't try and pull and push under. You got to go over. You don't have enough room between your fingers and the tube holder and the arm. And you hesitated, but you did use the right order of draw.
Okay.
Because why don't you want to draw the lavender before the chemistry? Do you remember?
Because of contamination with the additives.
Which one in particular? What part of it?
This serum.
What in the additive in the EDTA is going to affect a result in chemistry?
Isn't like the glass particles in it?
Nope.
No.
This is her question.
Okay.
Pick up the tube and read the additive. It'll say what's in it.
Where does it say? Just
under the BD vacutainer. What does it say?
K2 EDTA.
Yeah. So what's in there that?
The K2. What, I don't know what it means.
Potassium. The K is potassium.
Okay.
Okay, so that can carry over into the chemistry tube.
Okay.
And just because we're only drawing a glucose on that now doesn't mean they're going to add on lights or something later. So you always have to assume that.
Okay.
So now he's holding it, putting nice good pressure. Tell me what goes on the tubes.
The labels. My initials.
I'm like, yes, the label. Fresh. I was like, if I didn't know you, I think you would be in fresh right now. Okay.
My initial and the time of draw.
Yeah.
My initials, the time of draw, and the date.
Yeah. Then.
Oh, goodness.
3 things that have to do with you, 3 things that have to do with the patient.
The patient's name, date of birth, and the medical number.
Yes. What department do they go to?
This one is going to, the purple one is going to hematology.
Wait, what test did I ask you to draw?
You told me to do the hemoglobin, the
A1C.
A1C,
Where does that get tested?
and chemistry.
There you go.
And then the glucose is also going to chemistry.
Yes, ma'am. And deliver to the department. All right. So now it's time to bandage him up. So you want to take 1 square of gauze, fold it into another smaller square. Now you want to take it and check the site. Check for mounding, check for bleeding. He looks pretty good, other than red from pushing so hard on it. And then you can ask him to hold it again. But yeah, if you couldn't, you'd have to do that too.
Okay.
And you can't preload your glove with tape. That's against Department of Public Health, even though a lot of people do
I
that.
do that.
What's that?
I said,
Everybody in the real world does that, but not you and not you people, not you black squares with names. You can tell it's Thanksgiving week because there's only 3 people here. All right, so now clean hands. I am going to clean my hands, take a quick water break because as always, I'm desperately thirsty. And then it'll be Antoine's turn to draw.
Oh, I'm allergic to like yeah.
I might have to like reward that. Yeah. What's the bathroom?
I guess you just go around the corner and pull an arm out.
Yeah.
Yeah.
Can you pull an arm out? That looks.
I think the shirt itself is gonna be the tourniquet. Which way is the bathroom?
To the left, to the right, and then you'll see it on the left.
Yeah.
Oh, look, Cheryl's running late.
I don't know. I have to do it first. Okay.
All right.
This is a good thing. I have to take that shirt off because I feel cooler now.
They were different colors. They were like white and red, I believe. Like I was, it was no, it wasn't. It was
Sanitizer.
I know.
Screen.
Screen.
yeah.
All right. Hopefully everybody will be here soon.
But inside was white. So what is that? Like,
More COVID letters from the school, no surprise. All we get is
More people testing positive.
Yeah, my kids' schools. I think as we progress, that's just what's going to happen. So.
Yeah. Especially as we get into the winter months too.
Yep. Okay.
No, she didn't go down me, but I was just.
How did you get for your thing not to get foggy? Or was it foggy?
It was, yeah.
No,
I don't think it's foggy. I just think it's that like it's that
yeah, it's
film on
not
it.
it's not clear.
Yeah.
Yeah.
That's why it's not you.
Okay.
All right.
I'm like my hot breath.
Right. Okay.
All right. Hello, my name is Antoine. I'm a student at BCC. Can I draw your blood?
Yes.
What's your name and date of birth?
Veronica Rodriguez, March 3rd, 1986.
You get to get creative, huh?
Have you been fasting?
No.
Are you allergic to latex?
No.
Good job. Yeah, every time I try to make up something like that, I like blank.
I'm gonna try this.
All right, so you can try and feel all you want, but you won't feel anything without a certain something, right? Right? What's the matter? 1 week off and you're out of practice? Tighter the better.
I know.
Tighter is better?
Yeah.
Well, not too tight because you don't want to like completely obstruct blood flow. So yeah, sideways palpate. Don't pet her. give her like. I mean, you got to really like get in there and feel for it, man.
Oh, that's probably why I never feel anything.
Yeah, because like too many people are like,
yeah, that's what
that's gonna do you no good. Don't be nice. Got one? I do. It's beautiful. It's beautiful.
Right there.
Yeah,
Like
so you
on
don't want
this?
the tip. You want the pad of your finger.
I feel it better.
And now he's flipping me off.
For some reason, I feel it better with my right here.
Yep.
Okay.
Can I feel it?
Yeah.
Nice big rope.
That's weird. Like from my, it's, I don't know. I could feel it better with my middle finger.
Yeah, and it's like you can feel it like bouncy.
Bouncy, very bouncy. Yeah.
Nice and bouncy.
Yeah.
So if you feel like it's like a bouncy house where you can kind of do this, then you know you've got a vein. If it's like if it feels kind of like this and it's like it doesn't give you any resistance, then that's probably a tendon. I've had one student accidentally hit my tendon once.
Yeah.
And it was like almost too late to correct it because she was drawing my arm and I was like, oh, I'm like, okay, you're gonna have to take that out now. Skip step. Do you know what step it is? Are you right or left-handed?
Right-handed.
Okay, so all your stuff's gonna have to be on this side, but you're missing a step.
This.
Yeah, there we go. Clean first, assemble later, which is probably not what you do in the ER right now.
Yeah, I'm trying to like intentionally change my ways.
It's hard. It's very hard when you've been doing it a certain way for a very long time. Yeah, make sure you check these needles because we've got some funky ones. But obviously don't check it till the tourniquet gets back on. Oh, and I have to give you a test to draw. All right, we're gonna do a TIBC and an RBC. I gave you all initials. TIBC, TIBC, and an RBC.
I know the RBC is the red blood count.
Yep.
And that's going to go to hematology.
Correct.
And on a purple top.
Correct.
And then
nope, wrong side.
What do you say?
TIBC.
TIBC. Can I ask what it says? Or that give it away?
Might give it away. See what you can come up with without me telling you. Can you remember what it is? Or do you not know what it is at all? Anybody online know what it is? Hey, look, I'm seeing if you're paying attention. No? No one knows? Oh, Doris knows. Go ahead, Doris. Or did Doris just raise her hand for no reason? Oh, Sam knows. All right.
I'm gonna guess it because of the last two. I'm gonna guess it's a blood count.
Nope.
So, no,
it's not.
Is it like
Total iron binding capacity.
Okay, so that's something. It's something in the blood, so it's gonna go to hematology as well.
Nope.
Gonna go to chemistry.
There you go.
On a green.
Nope. What's our go-to? Yeah, gold. There are some places that can do it on that PST. Remember that. But for now, go-to is our SST.
Okay.
So Doris, I don't know if you actually have your hand up or not, but you're either waving at us or I don't know.
Just waving.
Just waving. Okay, check your needle, check that bevel just because we've got, you probably don't do that in the real world?
No, I do. That's
okay. Okay, so make sure your thumb's in the middle, not at the top. There you go. Your angle is too low for, you're not putting an IV in. You gotta have
more.
Stack your fingers, yep.
More at the top.
There you go. Go right in, okay, little slow.
Too slow?
Yes. Okay, and that's okay. Just so nope. So you're gonna when you establish blood flow, you're gonna pop your tourniquet. We always pretend that we establish blood flow here. All right, so then you can take your tube out. You good, Veronica?
Yeah, I'm good.
Okay, so make sure you rock it right away. Then change the tubes just because I want you to have practice with that as well. Sorry. And then, yep, make sure you use your phalanges. Don't jerk it too much. Close it, not with your thumb. Okay. Which tube should you draw first?
Did I draw the purple first?
You did. You went for the gold top first and then hesitated.
But I did draw my purple first.
Yeah, you're not supposed to draw that first.
Because I got potassium.
Yeah, see, yeah, did you hear Cheryl? Lavender last.
Thank you.
Lavender last.
Technically, it's gray top last, but you know. We don't draw grays that often.
But in this situation.
Yeah. All right. So you already told me where the departments go. So label the tubes for me.
So it's going to be her initials, her date of birth, her MRN, my initials, date of time.
You said them together.
Yeah, I know. It's a date and time.
Yeah. So one of the things you've got to work on that angle. You should be going in at an angle like this. Okay.
Sure.
You're going in like this, and you went way too slow. Like it's like that's why did you hear about how?
Yeah.
Because it was so slow.
Okay.
So you know how they always teach you when you teach CPR, like staying alive, staying alive. You want to put your needle in just like that. Okay.
Okay.
Get that nice.
Was the needle a little?
You want to just like get to it.
Is it good to put the needle in like a lot or just a little bit?
So for his vein, you just needed it under the surface because his is way on the surface. Yours is not.
Okay.
So that you would have had to go in a little deeper. So we don't have access to these electronic videos because I don't know what happened. But in these videos, they kind of say in your mind's eye, like it's basically imagine what it would look like inside your arm.
Right.
You know, and I have something at home that I might be able to do and like do a little video so you can kind of see where it's at, but I'm not sure if I can record that. It's tiny. All right, so bandage her up. That was a tough one. I think it was off to where you were is off to the right. So the vein is a little more on this side, and it felt to me like angling this way, so you may have been too straight with your needle. So yeah, you're not threading an IV. Not threading an IV. That's what you got to chant in your head.
Yeah.
You'll get there. We have this, oh, no gauze in there ever again.
Okay.
Sharps only. You know that.
Okay. Yeah, I do know that.
All right. Okay, so you can let her out. She's good to go. Keep your face shield.
Thank you.
All right, so now we're going to switch up. So, Veronica,
Yep.
you have a vein on that one too, right? Cheryl, why don't you take them together, and then Antoine's going to draw me as his second stick. Sorry, not to put you, but are you okay with me not having a face shield on, only because I need to be able to see to teach you, and the face shields are foggy. All right.
Okay.
Yeah.
Is that two
Yeah.
seats?
Oh, there's 4.
Oh, really?
Look, there's 4.
In here?
Yeah.
Oh, wow.
Go in that corner over there, then we're not bumping. But
Sorry, I saw you join the Zoom. I'm like, you're supposed to be on here.
I'm zooming, I'm like, okay, like it's still waiting for me. And then I saw your text. I'm like, oh my God, I'm still driving. I'm like, I thought I didn't know.
Where is she going?
I know it wasn't for Zoom. I wouldn't have known your name's Veronica.
Really?
Yeah, it was even Veronica.
Yeah.
With a V.
With a B.
I know.
Yeah.
I didn't know until I saw it on Zoom. Yep.
Everybody's always like, are you sure? I'm like, yes, I'm 100% sure.
So butterflies are the lazy way to do it. No, butterflies, so people habitually try and do butterflies
What are we doing?
She is your patient.
when
She is your, not pretend,
It's-
she is your.
well, when they want to make it
real
easier,
life
but
patient.
it's usually hands, hard to obtain veins that are here, like really skinny. Like I would, if yours was any skinnier, like in that area, I would consider using a butterfly just because you can
Okay.
control it a
I
little
was about
better.
to say.
Those you need like an IV,
Yeah.
not the regular hubs. These are harder to learn, but a heck of a lot easier.
Yeah.
All right, so let's pull this closer so they can hear.
Am I getting anything?
No way, you're funny. Just give Cheryl a minute. Okay. All the way top. Okay. Not this side. I have nothing on this side.
Okay.
All right. So you're gonna draw. Let's see. Let's see. A vitamin D
Okay.
and
I just want to see.
vitamin. Oh, by the way, Alexander, we are recording. So you're on. Yes.
Yep.
Yes.
You're alive.
So yeah. So you're live. I don't know what you were talking about, but it was recorded. We'll hear it later. All right. So you're gonna draw a. What did I say? Oh, vitamin D and an ESR. No, I gave you ESR last time. Recheck.
Vitamin D, that's gonna be.
Is it a cell?
No.
Is it an antibody?
No.
Is it an infectious disease? Is it floating around in the liquid portion of your blood?
Yes.
So then where does it go?
Hematology.
Oh, you said it wasn't a cell. You're killing me,
I know.
Nope.
Chemistry.
Remember all the rest of the leftover stuff? Because majority, if you look at, oh, I covered it up. Grab the requisition out from underneath there. See it right there?
Mhm.
Okay. Do you see how many tests are listed in
Yeah.
chemistry? The majority.
Yeah.
So if it's not a cell, if it's not an infectious disease, it's not an antibody, it's not a coagulation factor, there you go. What do you need, Cheryl? Oh,
So that's gonna go to chemistry and
correct.
a yellow top.
No, it's not yellow.
Gold top.
Veronica's
I
not
know, I
even
know.
doing it now.
You can start
Gold
here.
top.
Oh, yellow.
Gold top.
I'm gonna take this to the wall and be like, this
Not
is
yellow.
gold, not yellow.
And then the other one was what? The
Retake.
Retake.
Reticulocyte count.
So it's a count, so it's gonna be hematology
Yes.
and a
Are you
lavender top.
Do you know what a retake is?
I don't.
It's a teenager red blood cell. So it can do everything that a fully grown or fully developed red blood cell can, but it's just still a baby. So it's got little leftover pieces
Okay.
of RNA.
So Iron Fibrin.
Is that a new tourniquet?
Yes.
Okay.
Yeah, yeah.
Yeah, usually if they're not soiled, we don't do it, but in this case, since it's COVID, we reuse. We don't reuse, excuse me. Okay.
So my name is Antoine. I was gonna say I'm a tech, but I'm a student at BCC. Can I draw your blood?
Sure.
Are you allergic to latex?
Yeah, I am actually.
Are you really?
Yeah.
But nothing latex, all right? Okay. Have you been fasting?
No, I feel like I have, but no.
And your name and date of birth, please.
Kelly Hiller, let's see, 1/1. I'm gonna make myself young, 1985. I officially like don't have my tan anymore. Can't miss that
I
one.
know. No. See, for some reason, I feel it so much
Yeah,
better with the
go ahead, keep flipping your teacher off.
Just trying to see which.
So so what direction is it going?
I'm gonna say it curves up like no.
So you're gonna be drawing like in here.
Mhm.
You can see where I draw myself all the time for my students.
I'm just gonna have to do it right-handed because you're.
It's a straight shot. Like if you feel it, you can actually feel it still up here. Sideways like this.
Okay.
Sideways palpate, you'll get a better. Okay, take that off because it's.
I'm sorry.
You are a very tight tourniquet tire. Don't forget to switch out your, although it's very pretty, don't forget to switch it out. I do like it.
Can I just like, don't, you're gonna tie it, but don't put it all the way through. Just leave the little,
Yeah.
you know, instead of
Cotton
tying
cell.
it all the way through.
That's
like
what
your
happens,
Like shoes.
Yeah, so instead of putting it all the way through, just leave like a little bowl.
What?
I submitted the code, test code,
Okay.
You know, how your first shoe.
mark it 0.
All right, then you didn't get the code right.
No, it is right. I put it right.
Yeah.
Okay, I'll just.
I put it right there.
Yeah, keep trying.
All right, so now you're gonna have to close that needle and start all over again because you didn't put the tourniquet back on yet. I gotta focus on this, Delia.
Okay, yeah, just to let you know, like if you want me like to email it to you?
Why?
Yeah, we'll do that because you didn't put the
You
tourniquet
should
back on.
cross it before
You
you
can't put the needle down once you
How are
open
you
it.
gonna?
Oh, okay.
Yeah.
Pulling out, she needs to tie that
Right?
tight so that she can lose her arm. So.
You're gonna lose your arm.
I'm sorry.
Cross it right down. Nope, don't grab anything, just cross
Cross
it.
it.
Nope,
Cross it.
like
It's
with your
okay.
hand.
Doing.
You're telling me to go this way, right?
Hey, stop sharing test codes.
Okay.
Oh, I see what you mean. I see what I did. Okay, okay,
So
yeah.
now, no, you're good right now.
Okay.
It's not open yet. So you have to put this
Yeah.
back
Gotcha,
on.
I understand.
Yeah, okay.
So then what do you do with that when you have to use
Go
two
right in.
hands to tie the
Go right.
needle?
Yes, yes, okay.
Although
I don't know why I had a brain fart with that.
it's because you're drawing the teacher and you're being recorded doing so.
Uh-huh.
All right.
I'm so sorry.
Okay, so now you got your tubes. So now you're gonna check your needle. So so now grip your needle, your holder the right way. Now don't pull this finger out of the way. Stack your fingers. So like I stack them with my middle finger right up in the middle, like this. No, the middle finger in there, so then it gives you a little leverage. Okay, so then when you go in, go ahead and anchor with this hand. And then so see, you're gonna go in like an angle like that.
Okay.
Hold on, let go. I'm gonna let you go. I just don't wanna.
Okay.
Okay, and then go right in. Remember, staying alive. Good.
Nope.
That's okay. You're good. Don't worry about that blood. I'll tell you afterwards what it is, and that's okay. Okay, so use your phalanges. So now you've established blood flow. You're going to release the tourniquet, and then you can take it out. Remember, rock right away, and then we don't need to do that too. It's fine. Okay. And then don't push down to the needles out. There you go. See how much different? It's a lot easier when you've got. So when your needle is too shallow, you don't have enough room to use the phalanges. You're too close to the arm.
And I think what I'm doing too is I'm not putting that third finger under.
See, I always do it like this, so then I keep that angle.
I think what my problem was too is I was
you
doing
can
it
pull
like
it.
this.
Yeah, so when you put that third finger under and you stack your middle finger on the tube holder, and then you stack your fingers, it keeps that angle for you. That drop of blood, you are a very tight tourniquet tire. So that drop of blood was, you were halfway in and out of the vein, so it kind of skirted out a little bit. I also have been having headaches, so I've been taking probably more ibuprofen than I should, so I'm bleeding a bit. Well, that's good. All right, so what goes on the tube?
So my name, date, time, the patient's name, MRN, and date of birth.
Correct.
Make sure it's good.
She's a little squiggly here. It kind of points to where.
All right, not bad, sir. Not bad at all. Take up all your trash now. That, throw it away. Yeah, I always, if you drop tubes, even though they're not glass, when you drop them, just because if we centrifuge things, it can actually cause like a stress type fracture.
Right.
So we want to be careful on that. All right.
Even when it's filled too, would you, like, so if, say if I had it drawn and I dropped
Yeah,
it,
right there.
would you redraw that too?
I wouldn't, but you definitely have to be careful with it. So if you can avoid it,
Right.
do so, but don't start a new draw just yet for that.
Okay.
I'm sorry.
You're so patient.
Okay. I'm gonna let you like have blood.
That's okay, you have a lot of things to do, so you're
Yeah.
gonna clean it and you're gonna set up your stuff.
Okay.
And we still have to
You get
figure
to
out what
be-
color too and what
I
department
forgot.
PT goes to.
So it was
You get
PT,
to be
right?
a patient for someone else. And then, so what will you?
Don't worry, get all your stuff set up.
Kind of figure out how
And then I have to do, gauze, right?
Yep,
I volunteered today since we have an odd number of people.
don't be stingy with your gauze, you can
Okay.
a little bit, so you want a pile for her arm and a pile for your.
Tubes?
Yep, so your tube, so, or tube, go ahead. And
Hey,
all right, now you're making a mess. I'm sorry, can you help me there, but it's okay. I apologize.
I think it's moving to the, that's why I'm doing all the time, so it's easy for me to say it because I'm in the chair, but when I'm in your position, I start freaking out, so.
It's just 11 days after.
Sit here, you know your tubes, you know your
I
departments and
know.
everything. When you
Yeah.
stand here,
It's like a blank slate. I'm
I couldn't figure out what we're gonna do next week, so.
even on Zoom, you were on a roll.
Oh my goodness.
You were on a roll, and I was like, this girl's been here. I was so happy for you.
Thank you.
Okay.
It's crazy because
How did you guys do?
I do it at home too, like I'll have my daughter test me and I'll get them all wrong, but when I'm doing it on myself, like testing myself, I get them right. And
I
I'm
was
like,
sort of there, but.
and I'm like, okay, you can test me now, and my daughter will look at me like, what are you doing?
You only got
They're
one.
probably thinking, oh, she's never gonna pass this.
Right.
You've had one poke today, right?
Yeah.
Okay, so you're gonna sit in the hot seat,
Oh,
You're gonna
video
draw.
of the thunderstorm from this.
and then
Oh, is that?
you're gonna go and draw on Alexandra. She's done.
So do something first, then
And
white,
that's the
right?
idea.
Yeah, what tube, did you figure out what
So
tube you're
Antoine's
gonna
already
use?
got his 2 sticks, so he can be patient.
Oh, no, so you
So, yes,
wanna
we're
clean
gonna
it
get
because
you
while
some-
it's drying, then you wanna get all set
Yeah.
up, so. Yes, clean first.
All right, so Antoine's gonna be the patient over here, Larissa's gonna draw with me, and then Dahlia is going to draw Alexandra, and then when that's done, you're going to draw Larissa, and then we'll figure it out. So the idea is between this class and the next class in person, everybody gets an extra stick. Like, I don't think, we used to go like overzealous with 2 sticks a night for everyone. I don't quite think we need that with a class this small, so. All right, so you hot seat, you with me, Dahlia, you can sit and wait.
Hi there,
How are you?
good, how are you?
Just, you gotta sit out of the way though. You can't stand in the middle one. All right, so let me get this out of the way now. All right, Larissa, you can start while I think up some tests for you.
Everything.
I don't know, you tell me.
So
I'll
is
take
it-
it.
So, yep,
Okay,
and our.
I didn't mean start your equipment, I meant start from what you're supposed to do when you walk into the patient's room.
Okay, all right.
I mean, here you are, just like assembling equipment, and you haven't even acknowledged the patient. Lock and load, always remember to lock them in. Okay,
Hi, my name is Larissa. I'm a BCC student. I'm going to be drawing your blood today. Is that okay?
Yes.
Are you allergic to latex? Have you had anything to eat or drink today?
No.
Okay.
do you have anything on that side? Did we establish that, or?
Your chemistry?
You can try.
We can take a look at it.
Yeah, you can take a look.
We'll look at that, just take a look at that one, since you already got stuck on that side. We usually try to go opposite sides.
Yeah.
All right, so, what else you gotta ask him?
I'm so
Or did I blank out? Did you miss something?
No,
Okay. I think I
You-
have both questions.
no, you said, something else.
Something big? He knows who you are.
Oh, can you please state your full name and date of birth?
Antoine, August 3rd, 1996.
Wow, you're making some really young. We're making up birthdays since we're recording it. Figure let's not give away our birthday information.
I would match that with the requisition.
Correct.
I would check your.
Yeah. Which he's got one. He actually has an ID band. I love it.
I'm not sure. So I was thinking that would be.
Yeah, I got it. We're using the paper tape.
Oh, the paper tape. Okay.
Yeah, it's better. Here's the certificate. Okay, you gotta start by feeling the rain. Not without the tourniquet though. What you gonna feel?
Oh, yeah.
I did the same thing.
Which is funny. Put it up a little higher to get it out of your way. Yeah, you want to do it a couple. Like, it is, but I always ask permission. Like, is it okay if I put the tourniquet over your shirt? Just some people
Do I throw this out there?
say no, it's not okay.
So that's for That's too tight.
That's fine.
Yeah, okay.
Really, the smalls are that big on you?
These are medium.
I figured the small and kind of tight.
Yeah, but I think the smalls are gonna be too big. So go ahead and try, but I think the smile might fit you better. Don't be gentle. You want one, and you want to just palpate sideways, up and down. Have him make his fist though, because you won't feel much. And if you ever question it too, you can have you can kind of like keep your arm straight, keep your fist, but you can always have him turn his wrist, and then you can kind of feel the veins differently. Not that you have much. What the heck, man? He's got one under here though.
So I wait until it,
I just don't want to stick you on the same side.
no.
See, oh, you feel this though?
So it's fine. just
Feel
so
that.
You don't want to move it. What if it's not? Then we're not gonna worry about that.
I feel a little something like right here.
Yeah, but you feel it? It's like hard?
Yeah.
That's not a vein. That's a tendon. See how it's like rope? It's like
Yeah,
like
it's not
tight
like-
rope, not like spongy tubey rope. So then you want to look over on this side a little bit. Yeah, he's got nothing. Sorry, we gotta stick you on the other side. I mean, you got little things, but not for a pro. Whoops.
Really? I know,
Yeah,
I'm
she
so
was
nervous. I'm so nervous.
Did she just like annihilate the
Oh,
tube?
yes. Yeah. I'm like, oh.
Is that okay?
After it gave her blood.
Right? Seriously. Yeah, don't forget to remind them to make a fist,
Yes.
because that'll make a difference.
So if you had.
So yeah. Yeah, I know. That's the problem. He's got a great one there. Oh, wait. Feel that?
Yeah.
You feel that? That's beautiful. You know you have a straight shot there too? I didn't even look over there.
She's like right
Oh,
there.
yeah. It's like nice. Yeah, that's a beautiful straight shot. Okay, get your landmark
I
though.
didn't know that.
So,
It was under the skin box.
yeah, basically right where the tape mark points at. Perfect. You got a straight shot, man. Maybe you're more hydrated than last time, because I swear I didn't feel that last time.
That sip of water helps.
Yeah, that one single sip. All right, so before you start assembling your equipment, you got to do something.
Has anybody ever
What do you do?
Clean the site.
Yeah, clean it and then wait. Man, I have had a sinus headache that just won't quit for like weeks. I can't take allergy medicine every day though, because it makes me sleep.
You said you take your ibuprofen.
Like, no.
Yeah,
It's untied.
all the time.
You just do that?
Too much probably. Someday I won't have a stomach
And
line.
what, so how much-
Oh, yeah. Let's see.
Right, but.
Let's see. We're gonna give you, I'm gonna go with the theme, okay? So we're gonna do an alcohol and we're gonna,
First I'm eating too much, now I'm drinking too much.
and we're gonna do a triglyceride, because he's had some, he's been
Eating and drinking.
home eating and drinking, you know, during COVID. So we gotta check up on him. Don't laugh. I gained the COVID-20 and I have to go back for my labs and I don't wanna. I'm like, can we just wait till I lose it again?
I think that one's for the alcohol because that goes to chemistry, right?
Yeah, what's our go-to tube for chemistry though?
Oh, would it be the gold?
Hey, there you go. See, she called it gold.
I was gonna say the first one, not to go yellow.
Not yeller.
And then the triglyceride, that's the one that's on yellow.
So why?
Do you know what the triglyceride is?
Isn't it a protein?
No, it's fat.
Oh,
It's fat.
So why don't we say like yellow, we say gold?
Because yellow is a totally different tube
Oh,
that we don't like ever draw. All right, so triglyceride is a fat, right? So when we stop and think, right? Is it a cell?
well, it's a fat cell.
No. Is it a cell that we're going to count? What?
I don't think so.
No, it's not. So it's not going to hematology. Is it a coagulation factor? So it's not going to coag. Is it an infectious disease? Is it an antibody?
No.
So is it floating in the liquid portion of the blood? So then what department does it go to?
Purple? Oh, lavender?
No? Where do we test the stuff that's floating around in the liquid portion of the blood that's not a cell, that's not a coagulation factor? You know the answer to this. I know you
I
do.
know, I do. I'm just like blanking out right now. I don't know why.
Because it's
Been a long
me.
day.
Where do the majority of tests go?
Chemistry.
Yeah.
So it's me?
No. What's the go-to tube for chemistry?
Both the gold?
Yeah. Wasn't a trick.
Maybe I was thinking it was. I don't know.
I can go regular.
Wait, you already preloading? Dahlia, are you supposed to be doing that? You supposed to preload before the patient's even here?
Oh, no.
Do you think that's an infection control violation that you just assembled the needle and now it's just gonna sit open? It is actually. Department of Public Health will ping you for it.
I didn't know that, but I know that a patient would walk in and wonder, like, is that new? Is that?
Okay, yeah, I was just waiting for you. I didn't know.
Well, grab all your equipment and move it closer.
Okay.
Yeah, so one place actually got cited because people were preloading their butterfly, because they knew that they were going to ICU. When you see how she's fighting to get that in, you got to put it sideways when you do that. But so they were. Are you? Oh, you're left-handed, aren't you?
Yes, I am.
Oh, I'll have to go on the other side. Veronica, why don't you come sit over here just because I gotta go over there now. But they were putting the tube holders, like they were opening the package of the butterflies, putting the tube holders on the end, like 6 of them. I used to do it too. And then Department of Public Health came in and we're like, you can't do that. You can't preload your tape. We all did that too. You can't do any of that.
Are you talking about like putting it right here?
Yeah. There.
Yeah.
Or opening
has
a
to be
Band-Aid and
fresh.
putting it on your hand, or even opening it and having it here.
Oh, you touch it again. That's okay. That's okay.
You can have, and you can have her, if you have a patient that can hold it themselves. You can hold it when you get there.
That's just my email. It's just more stuff I'm gonna have to deal with.
You want to fog up like everybody else?
I'm already foggy,
Well,
so.
those are clogged. I don't know why we purchased non-clear face shields. Okay.
So you want to find a
Yeah, that's
vein
about 30
first,
seconds.
and then once you find the vein, you're gonna clean the alcohol. So while the alcohol's drying, then you'll assemble everything. You'll have something to do.
This is
while
a
it-
tough
while
chair
it's
for
drying.
lefty
Otherwise, it's-
draw.
Yeah, it is.
Why don't you have him move, Antoine, can you move your arm, just not your body, just your arm a little bit? Thank you. That way she's not like right up on the wall. All right. So grab an extra chunk of gauze, just because then when you put the tubes down, you'll have something to put them on, and then you can have some for when you have to come inside. Okay, so hold the needle right, always get the habit of holding the needle the way it's supposed to be held when you first pick it up.
Identify your name and birth, date of birth for me.
Yeah, that's fine.
4195.
Okay, so make sure your thumb's in the middle, and it's that plus, and your wrist is
Drink or
in
eat
the middle,
anything before you come?
like that. Okay, okay, so then you're gonna anchor it,
Ask her one more
and you're gonna go
question.
right in. Don't worry. Keep a nice tight grip on the needle, and then just go right in, nice and quick. Good. All right. So now use your, yep, so anchor right there.
Oh,
And you can have, don't forget, like, you can have a firm push on the fingers. Okay? So now we're gonna pretend that you've established blood flow, so you're gonna release the tourniquet. Always keep an eye on the needle when you do that. This is where people take the needle out early.
Okay, that's what I did last.
Yep, and then so you can use your phalanges to pull and push. Remember, pull and push. Nope. This is the part, remember, pull with this finger and push.
No, I
So watch the needle.
No, I'm not sure if you're gonna be drawn.
There you go. You gotta be careful with that. All right, and then you can just grab the gauze. Don't use the second tube. That's fine.
2 draws per person.
Yeah, so you might get one in each arm anyway. So just
Don't push down to the needles out. Engage your safety device on a solid surface. So you've got to put no. Stop. So you really have to work on those tubes because you keep like freezing up. You've got to be able to
I think I'm
practice
getting
that.
nervous. I think that's what it is too.
Well, it is. Your hands are shaking. You're nervous. I tend to make people nervous. It's just it is what it is. So you'll do your second stick with Cheryl. You're less nervous with her.
Yeah, I know.
But yeah, so one thing too is, can you lift up? I don't think
I don't know how to get out.
you want to go up a little higher.
Okay.
I wasn't gonna like tell you that. It's not gonna hurt him, but you'll have a better chance getting it in here.
Okay.
Like you gotta aim for that crook of the elbow.
First time I got blood in the tube, but this time I don't know why I just got so long.
It's
It's
me.
okay. Don't worry about it. He doesn't exactly have like tubes, veins that like follow the book. You can put those in the regular trash because they're not full. All right, so what goes on the tubes?
So for me, it would be my initials, the time, and the type of test it is.
No, don't care. Us techs know.
So my initials, the time, and the date.
There you go, okay?
And then for him, it would be his full name, his date of birth, and his MR number.
Okay, all right, and then we already
Like
talked about the
feel,
department,
like
so, okay. So now you gotta Band-Aid him up. Use we had paper tape, where'd it go?
I thought it was right there. I don't know.
Oh,
Oh, is it on the side?
no, they got 2 tapes over there. Somebody stole it. Stealing tape.
All right.
All right. All right, actually, Larissa, since we're at this stopping point, you're gonna come draw Larissa over
Okay.
here. It's just easier that way, and you're done.
Okay.
And you can stay and watch.
I will.
Here you go.
I'll watch.
I'll let you go through that one. You have to feel it. You can't just, you're not gonna feel it.
Next, fresh water.
Okay, you'll get better with that. Try to feel this one. I just want you to get in the habit of feeling.
Yeah, I can feel
You
this
can?
one. I
Okay,
I
good.
guess I gotta ease up on my ibuprofen.
Wow. What's the matter?
I'm bleeding a little bit today.
Oh,
Wow.
jeez.
Right?
That's bright too.
Right?
Alright, we'll go over there. Someone else will get that one.
What's that?
Alright, so like what I just did, right? Sometimes you need a straight arm, where the arm is straight, but they put a little crook in it. So I don't think you can do it this way.
Yeah, well, I
Like this.
had to, well, mine were already, the scrubs were already there when I picked mine up.
That will.
So I had to put the.
Will teach.
So what, you had to order this
one?
one?
Better sometimes. Yeah. I had to order one.
Okay.
Okay.
No, I just can't look at the needle going in, it's just. something.
Just off. Because I know my background, I get to watch. You can still watch always.
Yeah, I don't feel do that.
Yes, that's what I keep hearing. I don't have tattoos, but that's everything I've heard. So yeah, keep trying.
Like, we can't be here as often as we should, so we don't get that much practice.
Feel it.
Actually, you're not losing out other
That's a
than.
good one. So you get the,
I could-
oh, it's a good one too.
You're not losing out on drugs, we only met once a week anyway.
Even.
Yeah, this is better.
Yeah, like that.
Yeah. Yeah, so we're, other than the.
So the
Yeah,
pinch,
not
the
being
pinch
able to
hurts
go
a little
next
more when you
week.
do the outside.
It's
than
usually, because we always have one
Yeah,
but
yeah.
do draws.
Oh, good. Do you want to feel your face?
And stuff like that, so I
So
made
this
it
is
that
what she likes.
last week. And then of course.
But
the
this is the best seller or this
campus
is
closed
the
for
first one
Christmas,
here?
you know,
For silver.
like, great.
Yeah. So I don't want to do this one.
So yeah, so you're not really missing out on any draws.
Yep,
And
exactly.
actually, you've already gotten in more
Yep.
draws than.
She kind of
Really?
That's what I'm saying.
Yeah.
She's nervous, so
First of you're in the hot seat.
I can't. Oh, yeah, I can't.
It's very, very faint, so it's press at heart.
Well, you're using the tip of your finger too, Dahlia. That's not gonna help.
No, the finger.
You gotta use the pad, not the tip.
I'm using the pad.
I can feel it right down
You can feel it, yeah.
The thing keeps buzzing and I don't know.
All right, so
Maybe
like this
this is
one,
right.
you need to remember the directions. and
Yeah,
stuff.
go ahead.
Yeah.
Start. Ladies and gentlemen, start your engines.
Hi, my name is Veronica. I'm a student at DCC in phlebotomy.
Remember, made up birthdays.
I'm gonna take your blood. Is that okay with you?
Yes, it is.
Have you had anything to eat or drink?
Yes.
And you have a landmark.
Are you allergic to latex?
No.
Your name and your date of birth?
Larissa Susan, February 9th,
All right, so
1999.
take the turn for you. Clean it.
And you can confirm with her wristband that's on her forehead. All right, nope. You don't do anything until you. Look first, assemble later.
Okay. Do you prefer?
Don't ask her that. She doesn't know. No patient ever knows. Unless they're insistent, don't give them an option.
Okay.
Go with the dominant arm, which in her case is the left arm.
Where is it? A liver.
They're gonna have the stronger vein if they have one, or the larger one. But if you get, put it up a little higher, get it out of the way.
So now I'll have to put
There you go. It'll make it easier on you. The idea for like a successful draw is to like basically set up yourself not to fail. Have the patient arm in a good spot, raise the bed if you need to, put the bed rails down, get the tourniquet out of the way, have her make her fist, because you gotta remember to tell her that. That was to you.
I know. So when I looked, she already had it done, so.
Yeah, she heard it. But yeah, so that's how, like, anytime that I've ever tried to draw without like raising the bed or doing that, I've screwed it up. So, but just make sure that you put the bed back down and the bed rails back up. Does she have anything?
I feel something here, but I'm pretty sure that that's
And
nothing.
they were like, started to know them, like, what did you do?
She's got skinny minis. Skinny minis.
Cards and they are.
They usually have a hard time with me.
No kidding. All right, so then we'll take a look on the other side, just because those are all, she's got stuff, but it's little.
Sorry.
No, you're-
Give you a challenge.
Yeah, I usually am. I don't mean to be.
Nobody ever does. So remember, you can't go by like sight, because these, you can see, these are like skinny little surface veins. So you gotta find something good.
I feel one right here, I think.
All right, you wanna see?
So I'm not gonna put the book.
Yeah, it's skinny. Ooh.
There you go, just so it doesn't roll.
It's there, but it's really
Oh, I don't like looking at it. It's nothing, not you, not at all. It's just, I
Yeah, you can give it a whirl,
It's
but I'm gonna do the tourniquet, I'm gonna give you something else.
Yeah, you'd be surprised, the students are usually better than what you have done.
Well, when I got this one done,
Make this for me.
she did the
You
first
can't
one.
touch it again. Yeah, I know.
It's like really, yeah, like you said, it's still.
Yes.
I feel like it's normal, but I don't
There
know.
you go.
Yeah, everybody usually has trouble with me.
Really?
Yeah.
She said she has something for me.
Usually it takes more than one person to draw my blood when I go to the doctor or something, yeah.
It's good to learn.
You're not the only one.
Yeah, it's not that skinny, but it, whoop, sorry, I thought you had it clipped in there. I have a, like a little bit of a peripheral vision, like block with the bottom of the glasses and the top of the mask.
So this dropped. I don't have to change it out.
No, because
It's still in the package.
all right, so go ahead and clear up,
And we're.
and I'll show you how to use
Now,
this.
you see the
These are the type of people we save this for. Usually we go with a skinnier needle, but that's all I got.
Oh, yeah.
Yeah, yeah.
Take it out. The two.
Is it the button one or the like slide out?
These are push buttons. I like the push buttons here. Okay,
Okay.
so go ahead and get all your equipment ready.
I'm just gonna push it around a little bit.
Put pressure on it.
You also can put the stuff on this side too if you want to.
Okay.
It's up to you. You'll find it's a little different because you're using a butterfly. So one thing that when you use a butterfly, when you take it out, it's all coiled up.
Yeah.
So don't touch this black
Yeah, when I
piece.
give you instructions.
So you want to grab it just by the neck.
Yeah, I
You
just
want to
like,
fold
no,
this
no,
down.
You want to do.
But do you see this little black little piece right there? That's the button that's going to release the needle.
No, I was
Don't touch that.
Okay.
All right, so now this is ready to go.
No.
Okay, so now your tubes,
I have to just
you're
like
going to
convert it.
draw.
So do you want me to put this in?
Yes, how would you?
Not very creative tonight. Let's see. Larissa has not been good at taking her medicines. So we have to check her TSH and her T4 levels.
So first the goal. TSH.
Is that what you did?
Yeah. Oh, no, I did the.
Because she has the disease that I
first.
enjoy saying,
So it has to. be
Hashimoto's
first.
thyroiditis.
Correct.
Sorry, I gave you overeating and alcoholism and I gave her Hashimoto's.
When
So
you're
that would test her whole blood?
Nope. Do you know what TSH is?
No.
Thyroid stimulating hormone.
Oh.
Does that change your mind now?
She was quiet about it, but it wasn't.
Yes.
Okay. Are you okay?
Not fainting.
No, I'm good.
And that's gonna go to chemistry,
gonna take this. Just take one.
and
piece
it's
of
gonna be
gauze and
either
fold it into four.
red, green, or gold.
Hold on.
Which one?
This one?
I'm gonna go with
Just one
green.
piece. Yeah, one single
Gold to
piece.
gold.
Not too much.
At least you didn't say yellow.
What about the
You
T4?
know,
The T4, I have no clue what T4 is. Okay. So it would go into chemistry.
Correct.
You're free.
Genius number two.
No,
Correct.
okay.
Okay.
I thought so.
All right.
But the tourniquet is on, is I have to clean it.
On the phalanges.
Yeah.
No excuses. Practice.
I'm doing.
Practice.
Yeah.
I gave you a tube holder and
Oh,
tubes.
yeah, I'm doing.
Practice.
Yes, I am.
You too.
She gave you a tube holder.
You too.
Yeah, 1, 2.
I don't know. I'm just passing out YouTubes. All right. You have to draw Dahlia now
Fine.
because she stuck you. Are you good? You're a little pale.
I like to take
Little
like
bit.
this.
You feeling good?
I'm alright.
Okay, as long as you're sure.
Can I take a drink of mine? So fine.
Of course you can. And clean your hands.
To rest your hands.
Yeah, you got time.
And that way when you're changing your tube.
Okay. You ready, Freddie? So now this is going to be a little different. So you're going to pinch here. So see the grip? So you're going to pinch that, take this off. That's the bevel. This is where you're going to go in basically flat to the vein.
Okay.
And then once you're in, you can let go of the things.
Yep.
The wings. And then don't let this hang. Okay, so I always put this kind of like right here. And you always kind of be careful with that. Okay, so then take the plastic
So
off.
holding it like this, would it be a good idea?
No, never. Okay. All right, so now check that bevel. It's usually we usually don't have a problem with these. All right, so now you're gonna anchor with this hand, just like you normally would. Don't touch the side, okay? Anchor, and then you're gonna go straight in, just like you would like threading a needle kind of deal, or threading an IV. Just go right in. Good, now let it go. Okay, so now what you can do is grab your tube and you want to fill from the bottom up. So be careful though. See how when you move that, you move that? It doesn't hurt, but it changes how it goes. So you always want to keep an eye on that. So you would have blood in here if you got the vein, which you didn't because you shot it, you stabbed her to the left of it. So go ahead and just put the tube in like you normally do. If you don't have blood flow, you can always take your finger and kind of do this to open up the bevel, because the problem with butterflies is it sits on the top of the vein and closes off the bevel. So now we can undo the tourniquet and then take the tube out, rock it as usual. So now for this one, this is going to be a little different. So go ahead and put that tube holder down, grab the piece of gauze, and so you're going to put it over. You're going to put it over where the site is, but you have to go under here and squeeze that black button. Close there. And it pinches a little bit when it comes out, doesn't it?
A little bit, yeah.
Yeah, so when I first, and then the safety device is gone once you push the button, and you can't, and so the needle's gone and you can't use it again. Well, I remember the first time, so the first time I ever used one of those on a patient, hold on, I'm speaking right now, you gotta wait. I have to finish, you keep interrupting me when I'm in the middle of speaking, you gotta give me a minute here. So, and now I don't know what I was saying. Oh, so the first time I ever used one, when the gentleman complained, he goes, "Ow, that hurts." And I'm like, "You're just being a wimp. It doesn't hurt." And it actually, it's just a little pinch. So but the one thing you want to do is, and you didn't do it, you don't want to see the needle at all. When you put the gauze over the site, you want to do it so you can't see the needle, because if you're seeing a little bit of the needle, there can be aerosol coming out of that window, because it basically, the spring brings the needle right back. So you want to be careful that you cover that, but don't push down. Okay? All right, so you have to draw. So Dahlia, you are going to be sitting in as a patient.
Sticks I have to do today.
We'll see once we get through the last sticks that we need to do.
Because just I don't, like, you know, I faint, so I don't want to get faint before I do all the sticks.
You faint?
Yeah, I don't think that.
All right, so where are we at on time? All right, so I think because we're running out of time for today, so she has to draw because she hasn't yet, other than the one.
So I'm not gonna
You're not going to do another stick tonight, but you're going to have to do two the next time we're in person. So just remember that. All right, and you will too, just so we can catch up your other stick that you didn't get. She did okay last time. So make sure you take your laptop and your gloves and stuff off. All right, so you've had two sticks. You've had two sticks. You've had one.
She's had two.
I've had one, so I'm gonna do Valley right now. You want me to do two tonight? Or three tonight? I don't know.
No, we can't do three tonight. That's we don't have enough arms to go around. I only have one vein that really works well. So yeah, so you'll draw Dahlia.
Even if like when she drew me, she didn't get any blood. So that arm is still not.
I got blood from you.
Yeah. So is I can't use that arm. Or yes, or
I don't know. So either way, you're gonna draw with Cheryl on Dahlia.
Yeah.
Larissa, if you're offering up your arm, Larissa can draw your arm.
I have another arm too, so.
Okay, that's fine.
Well, you're drawing right now.
Yeah, that's all I got.
Yeah, you're busy. You're busy.
Sorry, I'm such a
busy.
Yep.
Getting the ball rolling.
Hello, how are you today?
Good, how are you?
Good. My name's Alexandria. I'll be taking your blood today. I'm a BCC student.
Are you sure you're good with that?
Yeah. All right. Can I have your name and date of birth?
Yep, Dahlia.
Whatever it takes to get us all.
And my date of birth is September 23rd. Thank you.
Would it be okay if you just put your sleeve up? Either one. I'll let you.
Let's steal this.
I can't breathe.
Take it off.
What does that mean? Beautiful.
You want to sit down? I mean, if we're sitting here drawing blood, you kind of need a refill.
Okay. What would you like me to be drawing today, ma'am? Don't make it
So hard.
Make it hard. Okay, all right.
She's struggling.
All right, so Dahlia's been really bad about taking her anemia medication.
Oh,
So, yeah, she's really non-compliant. So she's gonna need an HH, and she's also gonna need a retake.
Yeah, like,
Be too tight, maybe.
Oh, I did.
Okay.
Those look okay.
These are the small, because I usually have to try the small.
Yeah, because the other is gonna get in your way.
uh-huh.
So,
I mean, they're a
as
little
long-
tight over here.
So, as long as like,
Blood, so
does it like
blood.
give you like duck hands?
So it might be.
No, I think you might be okay. Because you don't want any excess around here. It's gonna get in your way and you won't be able to feel veins.
You're really doing good. I like your thought process. Okay.
I have a bunch of gloves from my she might be able to do but then it's for a long time. But those gloves, they're so tight, like you literally feel,
I call them duck
oh
hands.
my God,
If it makes you have duck hands, you can't use them.
they're so tight, yeah.
All right, what have you forgotten? Is this safe?
Yes.
Is it safe?
Is it safe? Right now, the way she's sitting, are we safe? Hey, all right. One thing, guys, so Veronica, I'm gonna tell you guys this too. Veronica was really good. She remembered that, because she got caught with it last time. She remembered to ask if there was anything in their mouths. Because now in the day and age with masks, we can't tell. So, because you can't have any gum or any lozenges or anything like that, because the last thing you want is a patient who you have a needle in their arm who is now seizing and or choking. What do you do? So always ask, especially since we can't see now. And actually, I forgot to remind you and you. So it's like one of those things that you take for granted. We're just not used to having a function this way.
Do you have anything in your mouth? Nope. Okay.
Hi, my name is Larissa. I'm a BCC provider. I'm going to be drawing your blood today. Is that okay?
Yes.
Can you state your full name and date of birth?
Veronica Rodriguez, 8/10/1986.
And then I would match that with the ID band.
Which is not on her forehead.
Oh my
Like you.
goodness.
What?
Are you allergic?
Did you lose something?
Yes. I'll look for it later, but it's
Yeah,
very
it's-
sentimental.
You took it off with your gloves,
Yeah.
guaranteed.
Are you allergic to latex?
No.
Did you have anything to eat or drink?
Yes.
Okay. Do you have anything in your mouth right now?
No.
Okay. Do you know where you threw your gloves away?
Yeah, over there.
It'll be in there. Do you know how much stuff we've thrown, how many hair elastics I've thrown away?
Yeah.
I know.
So you may want to think about that when you're on the job.
I know.
A lot of people don't wear their engagement rings, like mine's flat because it's not like one of those big, it's not a diamond. But a lot of people have thrown away their big engagement rings.
Yeah, we'll just need one.
Have you gone up both rings?
Yeah.
Which one has the decent vein? I think
It's the right arm.
there's little holes everywhere. Instead of like the book, Little Fires Everywhere, it's little holes everywhere.
She's got it. Okay. She's no first.
Okay.
Yeah.
It will be only in
No, yeah.
No, it's fine. I can see it's fine. Just have her, make sure you ask her to make a fist. You guys will have me in your heads when you're out doing this.
Yeah. Or just
Make a fist. Pastor Hulu says make a fist.
Just so they know.
You can let go of your arm.
You probably know that one.
Yeah, I did. I know.
Okay.
You want me to do it?
I don't believe you for a minute.
Great. I literally found it. I swear to God.
Do you though?
Yeah.
But how do you know, if it's a good one that's gonna fill, so you can
I
actually
didn't.
draw blood
I
from?
was just gonna do the tourniquet and then do it again and then clean it.
There you go.
I was a smart girl. Tricking you guys.
Ooh, she's
Right in the same
feisty.
spot. I felt something like more up there, but it is kind of high.
Yeah, I would go, so in this case, like normally we'd want to go distal to where it was poked, but down here you can't feel it. So I would go above that because that feels lovely. It feels lovely.
I feel it.
Here, hold on.
If you can
Ready?
go
Right there.
Oh, yeah.
Oh, yeah, right? How have you not like tried to feel veins on everywhere? So my husband has one
I
like,
do.
my husband has one down here. So like, I'll be like holding his arm and I'll just be like, he's like, stop it. I can't help it. I just kind of like poke at his vein. Yeah, you got one under there too, so I forget which one it was.
Yeah, right there.
But yeah, I do too. Yeah, so a lot of people have that. Do you know in low output in times where like people have really bad veins, a lot of chemo will go in through them.
I know.
I've seen that a bunch of times.
So Darius, tell me about your
I got to see a lot of different things when I worked at TA because it was a teaching
Yeah.
hospital, so it was a unique experience.
The one in Providence?
All right, so yes, the Veronica, let's see. Veronica wants to have a baby. So she needs an LH and a prolactin collected. You like that? You like that? I'm giving you like disease dates now. Although that was not a disease.
It's now.
Yes.
It's the end of my fourth. It's a hormone. It's going to chemistry.
Correct. Prolactin is also a hormone.
I realized that after I did that. I'm sorry.
And just to be sure, that she's healthy enough,
And I'm like, this is
we're gonna draw a hepatitis and an HIV too, just in case.
So I don't like need anything. And like, my mom's like, I just want slippers. Like,
Because if anybody's ever had a baby, you get the whole infectious disease panel before, when you first get pregnant,
Black Friday, but
among other tests.
I know, I wonder what it's
I
gonna be
know
like this year.
because everybody has to be 6 feet and everybody's usually.
What
like, on
department would
top
that
of
go
each
to?
other.
I'm gonna go to,
It's a department that would deal with infectious diseases and antibodies.
is it so?
You can't see me smiling, but yes, I knew you'd get there.
All right.
I hate this, nobody can see my facial expressions.
You have to do it, smile really hard so it can show in your eyes, right?
Yeah, then I can't see. Okay,
I'm still carrying on the tube. Serology is,
What are you gonna make?
you know this one.
yes, is it rare?
No.
Ah.
I know it's not like blue.
What do we need to test? Serum, whole blood, or plasma?
What's your favorite thing to cook on?
Chicken with.
Is it whole blood?
Nope. We only need whole blood when we're testing cells.
Amazing.
So proud of you. I remember, is it green?
No,
I used to love cranberry sauce.
it has a similar go-to compared to others.
Surprise. You want to hold that?
I mean, I guess the other two, is it gold too?
Yep. They're both they are. You don't need to do another one though.
So you could do it on the same tube if it's the same color?
But there was like a pain, so.
Sorry.
If both tests are the same color tube, you can just use the same tube.
Generally we can, but unless like it's a send out test or we need a separate tube or something like that.
Okay.
But that's good, yeah, that's good.
Okay,
because
so
We talking, do not think about.
did you clean her arm already?
I told you, tell me your
I
favorite
thought
dessert.
so. Okay, so I'm like, I hesitated for a minute.
Do you want to sit there for a minute? Oh, what am I doing?
You gotta wait.
You didn't see anything.
Oh, you're left-handed too. Switch,
Switch.
I got a picture.
Yes. That's always good. So you got a really good landmark for her vein. Wow, I am so thirsty today. I'm like sitting over here dying again. Don't get up right away if you're
Okay.
just hang out for a minute.
Is it usually hard for lefties to look at? Or is it a matter of getting used to
It's
it?
all about how well I can show her to do it. But I only know how to show how to tie a tourniquet. Righty.
Ready.
All right, so remember, so hold your tube the right way. So nice. And yeah, see, this is how I would hold it. Try and take it out of my hands. Go ahead.
Yeah, I don't want to go.
Let it go. she can't hear me. And I'm right next to her head. Yeah, so nice and tight, okay? And then you're gonna anchor. And then you got a nice landmark, so go right, and remember, go in nice and quick, act too slow. Okay, remember, use your phalanges. Yeah, there you go. Phalanges, okay? So now you pretend that you do have blood. Okay, so then you establish blood flow, you release your tourniquet. Watch the needle when you do that, because again, that's how we end it too soon. Okay, now take your tube out. So you want to grip the bottom of the tube with this finger, pull with this finger, and push against the phalanges with your back finger. So pull with this finger, like wrap it around the tube, and then push with your thumb against the phalanges. Pull and push. There you go. Rock it. Good. Just push.
Something that helps me when taking out is twisting it at the same time. Can we do that?
And push down, close your safety device right away. Good, what do you mean?
Like, so when you go to take it out of the,
A little bit, but.
No, that's good, you're a lot less shaky.
so when you go to take it out, like twist.
Yeah, whatever works for you. But, so you just have to show, so what I'm gonna have you do.
Shaking hands, but I just got.
Yeah, it's because you're nervous. Okay. So when I'm gonna have you practice, because you took home a tube holder.
Yes, I did. I practiced.
So, do you see how I'm holding this like this? So when the tube's in like this, I'm gripping it like this, and so I'm pulling with this hand, like with that finger, but I'm pushing. So like if there was no tube here, you'd see just my thumb pushing against here. So the idea is equal resistance. So like you think like Toy Story aliens, okay? You're pushing it in equal directions, but when the claw opens, it's got to be equal pressure as well. So you want to just pull and push at the same time, so you're not jerking it around.
So you're basically wrapping your index finger around the tube.
Yeah. So you don't do it that way because I think that it's easy. You push with the bottom, right? How do you do it? Because I think
So like,
I would put tape just in case.
I go like.
Yeah, so you use, so he uses like, so he
So if I'm
pulls,
set up like
so
this.
watch what he does.
So if I'm set up like this, I'll have it. I use my index finger.
So like so on his, he's pushing with this finger down on the bottom, and then like, so pushing here, but pulling with the thumb.
Okay.
So whichever works, so practice either way, because it depends on the length of your fingers. I've had to adapt it because my fingers are really short, so I have really tiny fingers, so it makes it harder. So we've had other students where they had to figure out a different way because their hands were so large. Like we actually had one student that could only use 2 fingers. She had to hide all of her fingers because her fingers were so long and wide. I mean, her fingers were like this much longer than mine. Giant hands. All right, so what goes on the tube?
For her, it's her full name, her date of birth, and the MR number, and for me, it's my initials and date and time.
Perfect. All right, and look at that, 10 of 5, just when we're supposed to be done. How exciting. All right, good job today, guys. All right, and we'll finish this up, and then I'll kind of give you a chat before we leave. All right, guys, so draws are done for tonight. Stay tuned for next week. We may or may not do some tube practice. I'm not sure what we're doing anything. Don't forget HIV consent forms. I love that, Sam. So anyway, I will keep you posted on what we're going to do next week because we won't be here on campus. So I haven't decided if we're going to go live or they're just going to have another assignment to do. So I'll keep you posted. All right, so take care, people, and if I don't see you, have a happy Thanksgiving.